Infectious diseases can be spread directly or indirectly from one person to another. It is also the body of an individual does not function properly.
HFMD, or hand, foot, and mouth disease. It is a syndrome characterized by fever with vesicular eruptions mainly on the skin of the hands, feet, and oral cavity. HFMD primarily affects infants and young children. Although infection is usually self-limited, severe neurological complications in the central nervous system can present in some cases, which can lead to death. Symptoms of HFMD are fever, reduced appetite, sore throat, feeling unwell, painful mouth sores that usually begins as flat red spots, rash of flat red spots that may blister on the palms of the hands, soles of the feet, and sometimes the knees, elbows, buttocks, and/or genital area. Hand, foot, and mouth disease medications are over-the-counter pain relievers like ibuprofen or acetaminophen or numbing mouth sprays. Don't use aspirin because it can cause serious illness in children. Cold treats like ice pops, yogurt, or smoothies can be used to soothe a sore throat. Also, avoid juice and soda, which have acids that might irritate sores. And lastly, anti-itch lotion like calamine can be used for rashes.
Hepatitis B came from the root word hepato, meaning liver, and medical terminology, itis, meaning inflammation. Kapag pinag-combine natin, ang meaning ng hepatitis B ay inflammation of the liver. Ang hepatitis B ay merong two types of infection. Ang isa ay acute hepatitis B infection and pangalawa naman ay chronic hepatitis B infection. Ang acute hepatitis B infection ay tumatagal ng less than 6 months at kayang pagalingin ng immune system. Mostly of adults na nakakakuha ng hepatitis B ay merong acute hepatitis B. So, for chronic naman, chronic hepatitis B, it lasts 6 months or longer. Mas delikado ito kasi possibly na pwedeng mag-lead ito into serious illness such as cirrhosis and liver cancer. Ang cirrhosis ay ang permanent permanent scarring of liver tissue. So, pwedeng ma-spread ang hepatitis B through sexual contact, sharing needles, lalo na sa medical needles sa hospital, medical equipment din, and mother to child. So, yung pinagbubuntis ng nanay yung kanyang anak, pwede niyang maipasa ito sa bata. And, of course, sharing of hygiene products. Sa hygiene products, lalo na yung toothbrush, na since na merong itong liquid material na saliva, pwede itong makuha kung kayo nagpapasahan ng toothbrush dyan. Kaya ingat kayo. So, symptoms ng Hepa B are abdominal pain, lalo na sa right side kung nasaan ng liver natin, extreme fatigue, flu-like illness, and pinakamadalas na makita natin ay ang jaundice. Jaundice is yellowing of the skin and white of the eyes. So, para malaman na merong hepatitis B ka, need mo magpa-blood test. Meron din namang option na liver biopsy kung saan tatanggal ng konting sample sa liver. Pero mas maganda yung blood test. Prevention, syempre need mo magpa-vaccine ng hepatitis B. Merong 2, 3, or 4 na tawag dito? Interval. Hindi interval Basta merong 4 na beses kang sasalpakan ng two, 3 or 4 na beses kang sasalpakan ng vaccine. Yung una is nung pinaka 1 year old, tapos hanggang matapos ng 6 months. Treatment sa hepatitis B, need mo ng antiviral medication. Pag mas malala na, liver transplant.
Virus, it is microscopic infectious agent. It is too small to be seen by light microscopy.
Genital herpes. It is a common sexually transmitted infection caused by the herpes simplex virus. Sexual contact is the primary way that the virus spreads. After the initial infection, the virus lies dormant in your body and can reactivate several times a year. Symptoms includes pain or itching, small red bumps or tiny white blisters, ulcers, and scabs. For the medication, there are 3 major drugs commonly used to treat genital herpes, which are the acyclovir or the Sovirax, the famciclovir or the Famvir, and the valacyclovir or the Valtrex. These are all taken in pill form. Severe cases may be treated with the intravenous drug acyclovir.
HIV, or human immunodeficiency virus, is a blood-borne virus typically transmitted via sexual intercourse, shared intravenous drug paraphernalia, and mother-to-child transmission, or MTCT, which can occur during the birth process or during breastfeeding. Symptoms of HIV are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. It is treated with antiretroviral medications, which work by stopping the virus replicating in the body. This allows the immune system to repair itself and prevent further damage. A combination of HIV drugs is used because HIV can quickly adapt and become resistant.
Ebola is a viral infection that enters the mucous membrane and spreads to the other parts of body. It is usually transmitted when a person comes in contact with another person with infected blood or body fluids. Signs and symptoms typically starts 2 days to 3 weeks when the person infected starts having fever, sore throat, muscular pain, and headaches. Currently, there is no specific cure that is approved by the market to sell. Treatment is to prevent it from spreading further, wear masks, and avoid places that you know that was affected by the virus.
Measles, a highly contagious illness caused by a virus that replicates in the nose and throat of an infected person. Generally non-harmful to humans, but is quite deadly to children and infants, also called rubeola. Yung main transmission niya is sneezing, coughing, or talking to an infected individual. Transmission of the virus may also occur if one touches an object containing infected droplets and rubs their eyes or nose after. This infection occurs in between 2 to 3 weeks. Symptoms include fever, dry cough, running nose, sore throat, inflamed eye, or conjunctivitis, among others. Measles are once common to the world, so treatment for the virus is almost always available. A vaccine is used to prevent the infection of measles.
Next is polio. Polio or poliomyelitis is a disabling and life-threatening disease caused by the poliovirus. The virus is spread from person to person and can infect a person's spinal cord causing paralysis. Signs and symptoms: sore throat, fever, tiredness, nausea, headache, and stomach pain. Because no cure for polio exists, the focus is on increasing comfort, speeding recovery, and preventing complications. Supportive treatments include pain reliever, portable ventilators to assist breathing, and moderate exercises to prevent deformity and loss of muscle function.
SARS or Severe Acute Respiratory Syndrome, respiratory illness siya caused by coronavirus called SARS-associated coronavirus or SARS-CoV. Napapasa ang SARS kapag yung infected person sneezes, coughs, or comes into face-to-face contact, lalo na yung may contact na sa body fluids ng infected person. Napapasa rin ito through kissing, hugging, touching, or sharing eating or drinking utensils with an infected person. Pwede mo rin makuha ang SARS by touching the surface where kung saan merong contaminated respiratory droplets na galing sa infected person doon sa surface, then pinunas mo sa mata, bibig, or ilong. And also, mataas ang factor na magkaroon ka ng SARS kung yung country na binisita mo ay may SARS outbreak and yung person na naka-close contact mo ay merong SARS. Symptoms ng SARS ay halos katulad ng flu, including fever na mas mataas sa 38 degrees Celsius, dry cough, sore throat, difficulty in breathing, malaise, loss of appetite, diarrhea, and night sweats and chills. Siyempre, kapag meron kang symptoms na ganito, need mo i-quarantine and kailangan matrack lahat ng taong naka-close contact mo para ma-prevent na yung pagkalat ng sakit. Para malaman mong meron kang SARS, ay need mo ng lab test na magpa-perform ng nasal and throat swabs or blood samples. Siyempre, nakakatulong din ng X-ray or CT scan na mag-reveal ng signs of pneumonia na characteristics ng SARS. Treatment, wala pang confirmed treatment, pero bibigyan ka ng antiviral medication, okay, vitamins, pampalakas ng katawan, steroids to reduce lung swelling para medyo makahinga. Then, pero hindi naman effective to sa lahat. Then, need mo rin ng oxygen or ventilator para makatulong makahinga. And, some cases, a-administer ka ng doctor ng blood plasma from someone who has already recovered from SARS. Siyempre, prevention. Siyempre, wash your hands. Don't touch your eyes, nose, or mouth without washing your hands. Wear disposable gloves. Wear surgical masks to cover your nose and mouth. And disinfect yung mga gamit sa bahay. Lalo na yung mga dumadating sa delivery. Hindi naman kasi natin alam kung saan galing yan.
Bacteria. This organism can live in soil, the ocean, and inside the human gut.
Cholera. It is an acute diarrheal illness caused by infection of the intestine with the bacterium Vibrio cholerae and spread by ingestion of contaminated food or water. The infection is often mild or without symptoms, but sometimes it can be severe and life-threatening. Symptoms includes profuse watery diarrhea, sometimes described as rice water stools, vomiting, rapid heart rate, loss of skin elasticity, dry mucous membranes, low blood pressure, thirst, muscle cramps, restlessness, or irritability. Cholera requires immediate treatment because the disease can cause death within hours. Rehydration. The goal is to replace lost fluids and electrolytes using a simple rehydration solution and oral rehydration salts. The ORS solution is available as a powder that can be made with boiled or bottled water.
Tetanus is caused by a toxin made by the spores of bacteria found in soil, dust, and animal feces, Clostridium tetani. If the Clostridium tetani spores enter wounds, it would release neurotoxin that would cause to interfere with the nerve that control muscle. Its symptoms consist of lockjaw, muscle spasm, trouble swallowing, seizure, headache, fever and sweating, and changes in blood pressure and fast heart rate. If you think you have or you already acquired the tetanus, visit the hospital immediately for treatment. You will be given an antibiotic and injection for tetanus antitoxin.
Gonorrhea, sexually transmitted disease or STD, caused by a bacterium that infects both males and females. It most often affects the urethra, rectum, or throat. In females, gonorrhea can also infect the cervix. It is caused by the bacterium Neisseria gonorrhoeae. It can most often be passed from one person to another during sexual contact, including oral, anal, or vaginal intercourse. But babies from infected mothers can also be infected during childbirth. In babies, gonorrhea is most commonly seen in the eyes. A common symptom for gonorrhea is the pain felt during urination, but there are differences in symptoms for both sexes. Treatment for this disease is possible. It should be noted that all prescribed medicines are taken and should not be shared. Permanent damage caused by the said disease cannot be undone by medication.
Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum subspecies pallidum. The disease starts as a painless sore, typically on your genitals, rectum, or mouth. Syphilis is spread from person to person via skin or mucous membrane contact with these sores. The syphilis symptoms may come and go for up to 2 years. They include body rashes that last to 2 to 6 weeks, often on the palms of your hands and sole of your feet. There are lots of other symptoms, including mild fever, fatigue, sore throat, hair loss, weight loss, swollen glands, headaches, and muscle pain. There are no remedies or over-the-counter drugs that will cure syphilis, but syphilis is easy to cure in its early stage. A single intramuscular injection of long-acting benzathine penicillin G will cure a person who has primarily secondary or early latent syphilis.